When is the last time you went to the dentist? I'll jump in. I got my teeth cleaned just last week. I got to talk one-on-one with my dentist and ask him questions. Do you wish you had a dentist to talk with one-on-one? Well, today, Dr. Shelley Olson from the North Carolina Dental Society is with us. She's clearing up all kinds of common misconceptions and giving you information so you can stay healthy. You can text her your questions right now. Here's how you do it. You text us the questions, 336-379-5775. Remember, the questions are anonymous and you get your questions answered right here and right now. All right, so first and foremost, let's kind of talk about COVID and dental care. A lot of folks haven't been to the dentist in the last year or so because of everything that was going on, which means that a lot of times they go to the emergency department for dental problems. So let's talk about what the issues are with that.
Well, hi, everybody. Good to be here with you today. The first thing we want to do whenever we have a dental emergency is call your dentist first. You can, at that point in time, see kind of what your condition is. Are you swollen? Have you lost a tooth? Is the tooth chipped? Kind of try to figure out what your emergency is. Most of the time, the dentist is the best person to handle that emergency because we can get you out of pain that day. Or if you go to the emergency room, they're going to look at you. They're going to tell you you need to go see your dentist. We are the oral health care providers for your mouth, and they're for the rest of your body. You do need to go to the emergency room if you have swelling down on your neck or that's causing you not to be able to breathe or see. Other than that, we're there for you.
Gotcha. Okay. All right. So let's kind of talk about some myths and the truths of those myths. First and foremost, dentists only check for cavities.
Well, we do check for cavities, but we do a whole lot of other things too. We check your mouth for gum disease. We check for oral cancer. We actually look at your face, your ears, your scalp to see if you have any skin cancer that we might need to refer you to a dermatologist for. We check your thyroid. We also check all your glands to make sure that everything's where it belongs. And that way we can keep you safe, all of you, not just your mouth.
All right, so and that is a key point right there about the checking for gum disease and checking for checking for cancer. Tell me what some of those things look like. He made me like stick out my tongue, and then he had this thing that was kind of heat operated, which I had never seen before.
So what normally we do to check for that, the first thing they're going to do is they're going to kind of give you a mini massage down your neck, feel all that. They're going to have you swallow. Then we're going to have you stick out your tongue, and a lot of times we're going to grab it with our fingers or with a piece of gauze, and we're going to pull it out, and we're going to sift it from side to side so we can see all the way back on both sides of your tongue. And we're going to have you say, it might gag you a little bit, but we want to see all the way down your throat to make sure everything's nice and healthy.
Okay. All right, so let's go to another myth and truth. Only go to the dentist for tooth pain or problems.
We want you to come see us every 3 to 6 months. That way we can prevent problems. We don't want you to have pain. We want you to come in so we can check your gums, check for cavities before they become a problem. Usually we can fix you before you even know you have a cavity. We can also check your gums, make sure they're healthy, and keep them in good shape.
All right, and so when we are doing the whole cleanings and things of that nature, that's about twice a year you get your teeth cleaned?
So for most people, it's twice a year. Some people have gum disease, and those people we like to see on a more frequent basis. So don't be surprised if your dentist tells you you need to come every 3 months. They just want to keep your body healthy. Kind of like if you have diabetes, you have to go to the doctor a little more often for them to keep you checked and monitored. It's the same thing.
Yeah, because it's not just your teeth health, it's your overall body health that is seen through your mouth.
Yes, we can tell other diseases that you potentially have by looking in your mouth. So don't be surprised if your dentist asks you what medication you're on, or if you've changed the medication because they're seeing changes in the moisture in your mouth, or if your gums are swollen. Sometimes we can even tell if your blood sugar's off a little bit.
Okay, interesting. All right,
or if you're pregnant.
Oh, interesting that you can tell all those things, and maybe even before they know about it. Okay. Last myth and truth. Brush your teeth harder to get better results and make your teeth cleaner.
No, we don't want to scrub our teeth. We want to gently brush our teeth with a soft toothbrush and kind of massage your gums in a circular motion. So either use a soft toothbrush and ADA approved fluoride toothpaste, or an electric toothbrush. And a lot of the electric toothbrushes now have a sensor on them to tell you when to switch quadrants of your mouth. They also tell you if you're pressing too hard or if you're not getting enough pressure on your teeth. So those are a great way, and also they motivate you because they have a timer and they tell you when your 2 minutes is up.
That's right, 2 minutes. You should be brushing your teeth for 2 minutes. All right, we're going to take a quick break. We're coming back with your text questions.